Hello, this is Dr. Firnhaber, and today it's time for 10 Minutes of Truth. So today we're going to talk about the many problems with major blood pressure drugs. Now, I'm not here to tell you shouldn't be taking them or you should be taking them, but I'm here to help you understand how drugs cause side effects and what are the problems and the deficiencies that are caused by the major blood pressure lowering drugs. So let's just start out by how medications affect nutrients. So every time you take a medication, it causes a nutrient deficiency. So there's three ways. Number one, the medications can attach itself to a nutrient and pass it out of our bodies. So medications can attach themselves to different nutrients, primarily minerals, and then our bodies get rid of them. The second thing, medications can alter the pH of the gut so the nutrients can't be properly absorbed. Number three, some medications need specific nutrients in order for them to work, and so they tie up these nutrients in the body. Now, let's look at some of the blood pressure medications. The ACE inhibitors. These are all the prils, lisinopril, lisinopril. These particular class of blood pressure medications, they basically affect zinc, magnesium, potassium, and calcium. So they cause deficiencies. Long-term usage of these ACE inhibitors causes deficiencies of the zinc, magnesium, potassium, and calcium. Let's talk about some of the side effects of losing these minerals in your body. Hair loss, slow wound healing, loss of taste and smell, loss of sex drive, leg cramps, high blood pressure, and increased risk of cancer, all from the loss of those four minerals. Now let's look at calcium channel blockers. This is amlodipine, verapamil. Again, this can get rid of potassium, deplete calcium, deplete vitamin D, and CoQ10. So what are the effects, the side effects of that, of losing these nutrients? Muscle weakness, fatigue, again, elevated blood pressure, irregular heartbeat, confusion, and bone loss, which we normally refer to as osteopenia, and if it gets too bad, osteoporosis. So you see, you can take a drug to fix one problem or to fix a symptom and cause a whole host of other issues. Now let's look at beta blockers. These are the alols, the atenolol, metoprolol. They deplete CoQ10 and melatonin. So the beta blockers cause problems with sleep issues, increased risk of cancer, autoimmune disorders, and memory loss. So if you take the beta blockers long enough, you may not remember you had a blood pressure problem, okay? So again, lots of side effects with this drug. Now, the last one is central acting blood pressure medications. So this is clonidine and methyl-dopa. These class of drugs primarily get rid of or deplete CoQ10. So what are the effects of that? Fatigue, muscle weakness, leg cramps, memory loss, frequent infection, liver damage, increased risk of heart attack, increased risk of cancer. So, it makes you wonder whether, is it really worth taking this? So what I want you to get from this 10 minutes of truth today is that pharmaceuticals deplete nutrients, especially minerals. And once you deplete those minerals, that causes a lot of other problems. Now, what we're going to talk about next week, and how I'll have this up on the whiteboard, is some of the ways that we can lower blood pressure naturally, that we can mitigate elevated blood pressure naturally in some of the studies out there. So stay tuned for next week's 10 Minutes of Truth. We'll show you how we can do things naturally without losing all of these minerals and essential nutrients. And we'll show you then some natural ways to lower blood pressure. So I will see you next Tuesday or Wednesday. Have a great week. Tonight, we do our talk on the importance of the nervous system in health and disease. That's at our office at 6:30. So if you want to learn about the nervous system and how it functions with health, and how the nervous system is so important in our health, either tune in tonight on Facebook or come to the office from 6:30 to 7, and we will show you how that works. Hope you have a great evening. We'll see you next week.